Botox. Botox is really the penicillin of the 21st century. Here is a medicine that can be used for urinary incontinence, decreasing prostate size. You can use it for hyperhidrosis and sweating. You can use it for anal fissures. You can use it in cerebral palsy. You can use it in young kids in Crumlin Temple Street Hospital this morning, just after being born. They're totally spastic. I mean, they're getting doses of 5 times the amount, and there isn't a word about it. It can be used, cosmetically for wrinkles, but this is a very powerful drug. This is something that goes across from dermatology to neurology, back into sort of, pain medicine, back into urology, into gynecology, and what a wonderful medicine to have at our disposal. And most people don't realise, I suppose, people turn around to me and say, is it a toxin? If you go into hospital this morning with a cardiac arrest or heart attack, we're going to be giving you atropine, lignocaine. All these medicines they're toxins from plants. Usually, both lignocaine and atropine, as you mentioned, they came from the blowpipes of South American Indians. Yeah. We use digoxin. Digoxin has been used since 1666 by Sir William Wuthering, the same time as the Great Fire of London, from the foxglove plant. And so all toxins are medicines that if you give them a strong enough dose, they will kill you. Yeah. If you dilute it down, the therapeutic to toxic ratio gets so little that we can harvest its benefit. And Botox really tops the list for this.
Well, a lot of people would say, oh God, no, I'd never have, I'd never have Botox done. Who'd want to put rat poison in their face?
Absolutely no association with rat poison. That's warfarin.
This is what people, your average person on the street, who wouldn't have read up on the benefits of Botox.
Amazing. When you consider that Botox has now been used something like 25 million scripts worldwide since its inception about 20 years ago now, and no real side effects in anybody. One of the most amazing things about Botox is the body has a built-in mechanism, not for getting rid of or excreting it, but growing new nerve waves around it. Yeah. So anybody who has a problem, be it a droopy eye, droopy lip or whatever, it disappears. So the second fantastic thing about it, even though we wouldn't inject a pregnant woman, the people who are getting Botox are usually female of childbearing age, and there's been something like 1 million, I think, patients that have become pregnant during the period they've been on Botox without any evidence, anecdotally or otherwise, that it gets into the serum across the placenta. I think I'm right in saying that. I know that you could have some people say, well, somewhere in Buenos Aires and whatever did something happen, but in general, a very, very safe drug.
But it's only safe if it's administered safely.
I think that's fair as well. Absolutely.
You see situations that are set up. You might see ads in the paper on the internet.
Yes.
I'm having a Botox party.
Sure.
And this could be me, and I've never done anything like that before.
And there's practitioners in this town that are doing it.
I might have seen somebody injecting somebody somewhere saying, "Oh, that's how you do that, grand. I'll do that."
Absolutely. It should be done certainly in safe hands. People that know the regional anatomy underneath. Certainly injecting the wrong muscles, it can cause problems.
Yeah.
There's no doubt about that. But if we take digoxin, which a lot of older patients listening to this radio station this morning will be very familiar with. Digoxin is one of these cardiac drugs. The therapeutic to toxic ratio of digoxin is only 2.4 to 1. So that means if the patient gets up, takes 3 times their dose because they're confused, they're in trouble. Therapeutic to toxic ratio of Botox is 60 to 1. Yeah. So a practitioner would almost have to give 10 bottles before they start getting into trouble. So the safety profile of it is phenomenal.
Mm-hmm. Provided it's done in a safe environment.
Absolutely.
Not going to the woman down the road who's having a Botox party for 10 tonight and 10 tomorrow night and 10 the night after.
Absolutely. I spend a lot of my time looking at both Botox problems and dermal filler problems. I mean, in the last week alone, I've seen 4, and it's a shame. But anyway.
But things can go wrong if they're not done in the right way. Listen, How can people get in touch with you at the Ailesbury Clinic?
Well, I suppose the simplest way is to phone. The Dublin office is 269-2255.
Okay.
And the Cork office is 021-485-7744. And most of the services we provide are on the website ailesburyclinic.ie.
So that's fairly straightforward, ailesburyclinic.ie.
Mm-hmm.
Always fascinating to talk to you. Thank you for joining us, Patrick Treacy.
Sure.
Thank you very much for joining us.
My
this
pleasure.
morning. Always good
Thanks,
to talk
Lyndsey.
to you. That is Dr. Patrick Treacy from the Ailesbury Clinic, ailesburyclinic.ie. Is that, am I right there, ailesburyclinic.ie?
Absolutely.
Excellent stuff. And that's the website. You can find out so much more than you ever thought was out there. Okay, Dublin.